Back. Well, cholesterol buildup can create some serious health issues. And today, Dr. Jan Swaronsky, yes, I said that right. Jan Swaronsky is he's an interventional cardiologist with Cardiovascular Associates. It's a mouthful. And he's here to talk about one of the conditions called PAD. So before we start, tell us what PAD is exactly.
Thank you for saying my name correctly. You must be Polish, Kelsey, I think.
That's it, yes.
PAD stands for peripheral arterial disease. And in fact, this is a buildup of plaque and essentially junky stuff inside the arteries. And it can be found anywhere in the body, in the legs, in the arteries supplying the brain, or in the arteries supplying your arteries in the stomach or anywhere else.
Now, is this something that happens over time, or is it a pretty quick process?
That's usually something that happens over time. What is interesting, that the diagnosis of peripheral arterial disease in itself, it's kind of bad news.
Okay.
Because the prognosis for these patients of prognosis for bad outcomes and death over the next 10 years, it's really high. So that's a major problem.
But lots of treatment options, and you wanted to mention one of the newer ones out right now.
So I think in any industry, including medical industry, you see a little bit of a paradigm shift. The things that have been done a specific way 10 or 20 years ago are not done the same way.
Right.
So we have the same. So what we do now, majority of blocked arteries are treated with something called endovascular therapies.
Okay.
And most names in medicine come from Latin. So endo is inside, and vascular means blood vessels.
Right.
So historically, patients who had peripheral arterial disease were treated with surgery. And now we see a very quick paradigm shift into endovascular therapies, that we get little tiny wires and balloons and different other pieces of equipment inside the blocked arteries, and the way we treat it.
And it opens things up.
And it opens things up. What is really interesting, that historically we have not been able to treat arteries that had long blockages, like 100%.
Okay.
You can imagine, even like if you talk to your plumber, if there is like a little tiny short blockage, it's probably not that difficult to unplug.
Right.
But if your whole pipe, like 20 inches of the pipe is blocked, that's kind of tough.
Right.
So we actually have technologies that allow us to treat it now, and our success rate is over 90%.
And you mentioned these blockages can be pretty much anywhere in the body. So
Correct.
I know people at home might think, oh, you're you specialize in the heart, that this would be a heart issue, but it could affect your whole body. So I know people at home might be wondering, oh, I have so many more questions, and unfortunately we don't have enough time to ask all those questions and answer them. But if people at home have more questions they want to ask you, or even come see you guys, how can they contact you for more information?
Sure. So I'm with Cardiovascular Associates of the South, and our telephone number is 510-5000. But nowadays, most people go online. So we are at cvapc.com.
All right. Well, thanks so much, Doctor. We appreciate you being here again. Good to see you again.
Good to see you.
All right.